Matthew Holt here, another THCB Spotlight. I'm here with Patrick Quigley, who's a fellow member of the No Hair Club, but a rather more dedicated one than me, and also as a CEO of Sidecar Health. So, Sidecar is an insurance kind of company. I don't know if he define himself that as but trying to really revolutionize how people are buying healthcare, and we'll talk more about what that actually means in a minute. I got very confused when I first went to the Sidecar a few years ago because I thought Patrick was breaking the law and doing all kinds of things under the ACA, but life has both my understanding was wrong and what Sidecar is doing has changed. And so we will start there, Patrick. What does Sidecar do? Who is it working on behalf of? I think you mean I'm going to say employers and employees. And how is it helping them buy care?
Well, first of all, I'm really excited to be here and have an opportunity to chat with you again. It's always a pleasure. I really appreciate the energy you bring to these conversations. So let's start with the very basics. Sidecar Health is a major medical ACA compliant, Matthew, as you know, health plan, health insurance company that serves large employers today, right? And so what does that mean? So we are like every other major medical health insurance company and carrier, like not that they're very popular necessarily always, but United, Anthem, all the Bucas, et cetera. So that's our product, but we're focused specifically on large employers. So companies with more than 51 employees, all the way up to Fortune 500. And literally our clients span that entire aspect.
So how long have you been focused on that aspect of the market? Give me a little bit of the history of how you founded it, how you got there, and then where you are as a company now.
Yeah, so I'm an engineer and a consumer guy. And so this Cycle Health started really around my own personal experiences and own family health journey, as you may remember, around my family not getting the coverage that they needed as my kids were young and were growing. So I was very frustrated with the ability to access care. And so when we came up with this idea, it was actually based on my personal health insurance, my personal healthcare experience paying for an MRI. And during that experience, I realized that I could eliminate barriers to care by paying doctors directly with a Visa card, as you may remember. And so not being a healthcare guy, but being a consumer-driven guy and trying to figure out like, hey, how do we break down these barriers to care? We actually launched a product for the uninsured to start with. Our concept, as you had kind of set up in our intro, our approach to healthcare is fundamentally different than every other major medical health plan in the US. We are about empowering consumers and driving access, breaking down barriers to care. But before we actually sold that to an employer, we wanted to make sure it worked for people. So we actually started with a product that enabled uninsured people. We started actually in Texas to access coverage like they've never been able to do before, and actually a little bit like a subscription model. After doing that for a few years, we learned how do you work in emergency situations? How do you handle cancer treatments, transplants, all of the big stuff, and then figured out, okay, now that we know how to make this work for consumers, for providers, let's go launch our product for major medical for employers, which we did in 2022. So we launched in 2022 in the state of Ohio. So that's where our carrier is domiciled. That's now where I live, Matthew, the wonderful state of Ohio. And so we started that journey then, and we've been the fastest growing employer plan in every market we've launched since then.
Excellent. And how many markets are you in, and roughly how many employers and employees on the planet?
Yeah, so we actually cover employees now in 47 states. We only sell fully insured products to companies that are domiciled in Ohio, domiciled in Georgia, and we just launched Florida. Texas will be next, and that actually will be it for a while. Our self-funded product, of course, is not constrained by where companies are domiciled. That's under.
All hail ERISA. Although let's
Yeah,
explain what health is, but that's
that
why.
might be the first time I've heard that comment, Matthew.
ERISA is an interesting beast, but go on.
Yeah, no, so that's kind of the status of the business. So yeah, and as I mentioned, our smallest company is a 51 person electrician group, and our largest company is a 60,000 employee U.S. employer.
And are you, give me a sense, are you, I think most of them are I assume for some of them you're the only choice, and for most of them you are a choice.
Yeah, no, for most of them, we're the only choice. So what
Okay.
happens is when we go in again, most of our the largest number of clients, of course, is the large employer clients. So you were talking about 50 to 1,000 employees is kind of the core. And for those companies, they generally like to have one choice. So we offer, we might offer four plans to an employer, so they have different options, but they don't offer us and another carrier.
Okay.
That's their choice, not ours. We're more than happy to be available with any other carrier. But, sometimes other carriers maybe don't want to be alongside us because we have no networks, no prior authorization, unlimited access, and we're also dramatically, as you know, less expensive. right? So it's kind of tough to compete with.
So the theory. So give us the theory of how it works. So now I am a employee. I've signed up with Sidecar Health. I now need to go off from the world of having medical care. You guys don't have a network. You have information on pricing. What do I do? How do I figure out what to do next when I need something? I need
Yeah, how does our product
I need
work?
that
Well,
MRI that you first.
100%, 100%. So we work like everything in your life except legacy health insurance. Right. So like we are literally the same as everything else in your life. So it's very intuitive for consumers, especially consumers that have, don't interact a lot with the health insurance system because they don't know how confusing it is. So the way that we work is we give all of our members a Visa card, like literally this is mine.
Hmm?
So with this Visa card, we enable our members to pay for care directly with doctors of their choosing with our money. Right? We don't have a network. We like to joke that Visa's our network. It turns out everybody takes Visa because it turns out everybody takes Visa. So suddenly you have unlimited access to go to the doctors of your choosing. So paying for care by giving people a Visa, it's not a credit card, it's a delivery mechanism for cash.
Yeah.
That opens up access to anything you need. But that's not enough. The second thing is about enabling transparency, right? So through our app, you can actually see what your benefits are for anything you can do in the US healthcare system. Every single drug approved by the FDA, right? Every procedure. It turns out there's 170,000 things you can do in the US healthcare system, right? So all of those are visible via our app. So for planned care, you can go to our app, look up your benefits, and then go call your doctor and basically say, hey, I need to come in for a doctor visit. What are you going to charge me? I'm going to be paying for you directly. And so that's the interaction for our member. And I can walk you through a demo later so you can actually see how it works. But it's really powerful. A lot of people don't realize when they're getting a knee replacement that they're actually spending $20,000. You should get treated like you're spending $21,000, right? Like it's a big expenditure, right? And you should be in control of that. So that's the core of how it works. The second thing to note is how we actually set our benefits. So when we enter into a market, we figure out what the average commercial rate is for a particular service. And we set our benefits based on that average, right? So some doctors are going to be more expensive and some doctors are going to be less expensive. And as you know, quality and cost are not correlated in the US healthcare system. And so that's where the power of this becomes really interesting. Because if you're going into a given market, you asked about MRIs, right? So MRIs are a great example, right? So everybody's machine is basically the same, right? You've got 1.2T, 1.5T machines, 3T machines, but they're all the same in terms of how we set benefits, right? So at the end of the day, let's say I live in Cleveland. Let's say you need to go get a lower back MRI. We'll go, okay, well, the market is basically charging on average $1,000 for lower back MRI without contrast. So we basically say our benefits are $1,000. Now, what you also then be able to see in our app is you'll see that, hey, some of the major hospital systems might charge $3,000 or $4,000 for that MRI. And then the standalone MRI places, we might charge 300. And our benefits are $1,000. So if you choose to go to a place that's more expensive than $1,000, first of all, you know ahead of time because you can either see it in our app or you can ask. Because one of the great mistakes in the US healthcare system is that people don't know what things cost.
Sure.
Like when you're paying for it with a Visa card, they have to charge you. So they are able to tell you what things cost, right? What's unknowable is the insurance negotiated rates because that stuff is super complicated, right? So when you go in and you say, okay, I've got $1,000 for it. Like if I go to this place, so they're going to charge me, let's say they're going to charge 2,000. I know I'm going to be responsible for $1,000 a bill. So I have to choose whether paying an extra $1,000 is worth it versus going to a standalone location that charges 300. I know that my benefit's $1,000. So I'm actually saving 700. What happens with that 700 is I get to personally keep half.
Okay.
So suddenly I care. And that's the key aspect. Our belief is the US healthcare system is broken because there's no transparency and then there's no motivation to care. And we change that. We give people transparency so they know the price. By the way, as you know, we also show the quality of the doctors so they can make good, firm, comprehensive decisions. And then we create motivation for people to actually take value into account in their decision making, something that's never been done in the US healthcare system before us.
So that's all sounds great, and we can get. I think we can and will get into a theoretical conversation about the limits of that later. But let's see, what does it actually look like? So, power up. I'm going to buy a
Oh,
drug.
you want me to log in? Okay.
Yeah, log in and log in.
Let's give it a dry run. All right.
Hopefully, this is the wet run.
With a wet run. All right. So what I'm going to do is I'm going to log into a demo account based on one of our markets. So I will use Atlanta. All right. Let me share my screen. Okay. So are you seeing this, Matthew?
Should be coming. There it is. Yep.
Awesome. So I'll do a very quick example. So this is our mobile app. This is to go ahead and manage all of your care. You can kind of think about it a little bit like an expense system. You go and you look up your benefits, you go access care. We divide care into two buckets, planned care and unplanned care. Unplanned care are like emergencies. So for emergencies, we just want you to go to any doctor that you feel comfortable with, any emergency room. You'll know that you'll never be responsible for anything other than your deductible if you even have one. So a lot of our plans don't even have deductibles because employers are saving so much money. A lot of times they eliminate deductibles. Similarly, we make sure that unplanned events, like maybe you go in for a knee replacement and there's a complication, well, that's an unplanned event. We treat that like emergency. You're never responsible for any of that. So from a demo perspective, we're going to focus today on planned care, things that
Okay.
you know ahead of time, where we want people to know what things cost, what their benefits are, so they can make decisions that are right for them and their family. So we'll start really simple. We'll start with RX, right? Prescriptions. So through our app, you can look up your benefits and local pricing. So let's pick the most popular prescription in the U.S., Lipitor. As we've talked about before, our coverage has, we want to make sure people have access to care. One of our core principles is nobody should ever have to pay anything for any needed care except their deductible, right? And they should have control over where they're getting that care. And so, for example, when you apply that to RX, drugs sometimes have generics, drugs are sometimes branded, drugs are sometimes specialty. So if a drug like Lipitor has a branded and a generic, we're going to set your benefits to the generic. That doesn't mean you need special permission to get Lipitor branded. You can purchase that too. You're just going to have to pay the difference. Unless, of course, your doctor says there's a medical reason for you to have Lipitor, and then your benefits would be set to the branded price, right? But when you're shopping, you have this choice about whether I get the branded or the generic. So I like to save money, so I would always go get the generic. So the way that our UI works here is probably pretty intuitive. You can toggle between branded and generic, the form, dosage. Let's say you're on 10 milligrams, you can adjust the quantity. What makes us special, though, is this box right here. So we're going to tell you what the average price is in your area. So in Atlanta, 23 bucks for 90-day supply of Lipitor. And we're going to tell you what your benefit amount. This is the amount of money that is the average price for or your particular service that you're trying to get, and it's intentionally set to the midpoint. And with that information, then you are empowered to go get the care that you need from the providers you're choosing. And that's where it comes to the map. So these are real-time prices from the Atlanta area. And then I'm going to highlight a few, not intending to pick on anybody, but let's start with this one. Green is good, red is expensive.
Okay.
So let's say you wanted to go to Walgreens. How would that process look? Well, you know right in the app that they're going to charge you $112. This is more than average and more than the benefit amount. So right here, you can see this is $89 over. But let's come back to that. Let's say you wanted to go to Walgreens because it was convenient for you and it was worth it for some reason. How would it work? You would literally give Walgreens the group number, your VIN number,
So that's like giving them your regular
just
insurance
like
card.
every other insurance company. They were going to ring you up for $112. You take out your Sidecar Health Visa card, you swipe and you pay
Is the
$112
$112,
comes.
Patrick, $112 is their cash price essentially to them, or do they go and hit some other system to come back and say the Sidecar Health PBM price is $112?
Yeah, well, we're not a PBM. We pull in, we have different partnerships with different companies to show different pricing depending on
Yeah,
kind of the
whatever.
market and whatnot. So this is a price basically that Walgreens is set based on these PCN numbers,
Okay.
right? And it's real time and updated. And
Yeah.
actually, there's a marketplace for how we determine what to show.
Okay.
So at the end of the day, they're deciding they want to charge 112, and we believe that providers should be able to charge whatever price they want.
Okay.
And then the employees or our members can decide whether they're willing to pay for it. So again, let's say this particular member is willing to pay $120 for Walgreens. So they know that they're going to be paying $89 more than the benefit amount. And how would it work? You take out your Visa card, you swipe, you pay. Sidecar Health pays the $112. The card is actually pretty awesome. It's smart. It knows that you're at a Walgreens, so it turns on. It checks in real time whether you have active coverage, you haven't left your employer. Assuming both those checks come back, we immediately deliver 112.39 to Walgreens. At that point, Walgreens is done.
Yeah.
They don't care. They've gotten paid, whatever. But the card isn't smart enough to know what you actually purchased. So that's where your phone comes in. You literally take out your phone and using the camera, take a picture of the receipt. And you load that in the Sidecar Health app back to Sidecar Health. We scan it. We actually leverage AI to read the receipt, and then we send you a bill that says, "Hey, you went and got, Lipitor. You paid $112. Your benefit was 23. Your responsibility is $89. This is not a surprise. It's right here in the app." And then at that point, you have the opportunity to pay that in any way you want. You can pay it with your HSA card. You can pay with a credit card. You can even mail us a check. You have 90 days to close out the transaction. And that's how it works. Does that make sense?
Yeah. So basically, whatever the arrangement was between the employer and Sidecar to pay you a premium or whatever you're charging them, there's this extra balance. There may be an HSA, and you can either take it out of that, or I assume you're going to show me in a second you can add to that. But
Exactly.
why do you go on and do so?
That's
So
exactly right.
let's throw into some of that was true.
Well, I wanted to show the
I
typical
can't
people.
believe there are many people voluntarily paying an extra $90 for 30 days for 90 days of Lipitor, but let's
It
assume.
turns out you're a smart man. Exceeding majority of people, once they see the pricing, decide to do something else. So this is a real-time map. You can see there's lots of green and some red. So why not go over here to Kroger? So Kroger is charging $19 for the same drug just
Right.
a mile or so away, right? So at the end of the day, a member goes, okay, wow, maybe I want to go to Kroger while I'm doing my grocery shopping. I can fill my prescription. What would happen here? Well, you'd give them your group number and bin number again. They're going to ring you up for $19 because that's what they want. You swipe and you pay. We get the picture, we scan it, we send you an email and say, hey, your benefit was $23. You just saved $4.42. And here's the magic. You keep half.
Yeah.
So this gets credited, as you just said, to your Sidecar Health account. It is your money. You can use it for a time. Maybe you decide to go to Walgreens to pay extra because it's convenient for you for some reason or for whatever reason. And at the end of the year, that's your money. It's actually given back to you through your W-2 at the end of the year. Or some employers, like we at Sidecar Health, our employees, they can put it into their 401k tax-free, right? So it becomes very, very meaningful. Check this out. The typical family of four gets $1,100 cash back per year on Sidecar Health.
So
It's a lot of money.
that's very interesting. So the and a lot of people have tried this, but because it hasn't been integrated with a sort of thing like this where it integrates directly in your insurance, because it is your insurance and it integrates directly into sort of the map of searching. The only slight caveat here is that when it's a prescription, you have to move this. Let's say your doctor sent it to Walgreens because it was in their system or whatever. You have to call
Well,
them.
why did you send it to Walgreens? Why don't you just tell them to send it to Kroger?
Oh, I mean, obviously, next time you will, right?
Yeah.
You should see me in One Medical. I have four different meds that I'm on, and they vary in cost between CVS, Amazon,
Oh, a
and
hundred
Mark
percent.
Cuban. So I have various where actually I have a drop down within One Medical as to where to send it, but no one's offering me money.
Well, yeah, but that's because they're all like different prices. Here's what's
Yeah,
really interesting. One of the things that we do here is how we use AI to make it easier for our consumers is you can literally say, hey, I'm looking for a 10 milligram avorstatin. Maybe you're on, I don't know, Vyvanse. I don't know how to spell these things. We can put any drug here you want. And
yeah,
what it will do is it will basically say, it will go look in your area for your basket of goods and say, hey, with these different groups, actually the cheapest place to go, look at this. This is unusual. So if those two drugs were your basket, you actually want to go to CVS because it's going to cost you $104 and $22 worth of savings, right? Where's Kroger here? So Kroger actually must be very expensive for Vyvanse right now. And so you don't want to go there
yeah.
because right. So this is the power of having data, having information, leveraging AI to make your shopping easier, and suddenly you're an engaged consumer.
Yeah, and then hopefully you can figure out, with your doctor where to get it sent. Or there are, I don't know if you're there yet. There's a couple of companies like Photon and some others who are trying to gather prescriptions that you can control and send around, which is obviously the next step. And maybe you guys should. I don't know if you're doing that yet. Have a partnership yet,
Yeah,
but
or you could just ask your doctor to print you out the paper copy. Like
well,
there's a million ways to
there
skin
are
that.
ways you can do it. Obviously,
Yeah,
you
yeah.
want to,
All right, so that's how RX
that's
works.
great.
Did you want to see like a medical example? Because there's no
Yeah,
PDF.
I think that. Well, that's the most complicated part, right? Because people don't know the pricing of.
100%.
Let's
So
let's
again, let's say you're looking for a primary care doctor. I don't know. Um, and you're just looking to go for a new doctor visit, right? So obviously there's returning doctor visits, new doctor visits. So the first thing we want people to do again at Sidecar Health is them to, for the first time, to understand that they're actually buying care and what is the price, what are your benefits. So in Atlanta, the average cash price for a first-time doctor visit is a $157, and the average benefit is $157, right?
I
They're
see
intentionally set.
one medical has not made it to Atlanta yet because that's about a tenth of
Ah.
their cost.
You might be surprised what they charge people that just pay cash.
Yes.
Um, in any case, so that's the first thing. The second thing to know is we are asking one of the questions I always get asked is, hey, this is such powerful insurance, right? No barriers to care, no prior authorization, no formularies, no networks, right? It's less expensive. What's the real challenge? Well, the real challenge is we're asking people to do things they haven't done in healthcare before, right? To engage in their care, to understand their benefits, understand and ask their doctors what things cost so they can make decisions. So that is a step that it takes time for people to get through. So like something like RX might be easy. Something like doctors, it might be a little harder for people that first time. So we have this concept called pre-check providers. So every market that we enter into, when we're setting our benefits, we set them to local commercial pricing. And then we go out and identify, like in our employer base, like where are people going to get their doctors? And we create pre-check providers. These are places where people can go and know that they actually don't need to act the price because the benefits are intentionally set above these locations. So like let's say you're looking for a new doctor in Atlanta, you go to Southeast Medical Group, they're guaranteed to be below our benefit amount. So you don't need to ask. So that's like the onboarding process as you're getting to know Sidecar Health. Let's say you're like, okay, great, but I want to go to my particular doctor that I've been going to for the last 2 years. How does that work? Well, you know your benefit amounts and you can go to the map just like in pharma. And what this is doctors that are coming to us and telling us, hey, I want to compete for your members. I'm going to post my pricing to you. Hospital systems do this, local doctors do this. This is also data from transparency data that we can actually go and load. This is also, here's what makes us magic is that we also get all the swipe data. So every time someone swipes, we actually post the price they pay for that particular service at that particular doctor online. So our members can actually see local pricing, know their benefits, and make decisions. And so you can see this whole list of doctors. Like I don't know who, Dr. Christina here is, but she charged one of our members the $123 or posted that price to us. And so if you go to her, you know you're going to save $34. What's the experience? It's very similar. You go, you tell people you have Sidecar Health insurance. If they're not familiar with us, because that often happens, you just say, that's okay. I'll handle the insurance. I'll be paying you today with my Visa card. I just need a receipt. And so you go, you see the doctor. At the end, when you check out, you get a detailed receipt or you ask for after visit notes. You take a picture of that, and that's how we close out the claim. You load that, and then we send you an email and say, hey, your benefit amount for that visit was 157. You were charged 123. You saved 33, and were refunded 617 to your earned benefit. That's how it works.
How often does the 123 not be the price that ends up being charged? How often is the data?
We encourage our members to always call and ask.
Yeah.
Right, like prices can change. It's not like it's often, but again, there's no contracts. We don't contract with anybody. It's a free market. So we just tell you that the most important thing to ask your doctor is not, are you in network? It's, I'm going to come in and see you today and pay you. What are you going to charge me?
Yeah. I mean,
Right.
and the more that happens, the more information you get, the more you.
Right. Like, and that's the crazy part. Like the community brings,
Yeah.
pricing transparency to itself. It gets smarter
Yeah.
every day.
And I think, people have tried to do this sort of, transparency stuff and costing stuff, but without the connection back to the payment mechanism. And then
Yeah.
you are putting together both a whole bunch of stuff going like CPT codes, the back end, doctor databases of doctors and hospitals.
100%. Like, look, we're not that smart, Matthew. This is obvious. This is why we believe every
Well,
single
it's obvious, but it's a very complex data problem in the back end.
It is, but the answer is obvious. It's obviously
Yeah.
better for people to be engaged in their healthcare, know what the decisions they're making, be in control of their healthcare, and be empowered. But you're right, it is hard technology, right? It's hard to make the credit card work title, and it's hard to facilitate the data. It's hard to make this work in a consumer way, which is why I started. Like I'm a consumer guy. I am an engineer. I am not, someone who spent 26 years working in health insurance. And I think that's the power of what we've done. We've designed something for people.
And then let's go look at something complicated. So I need knee surgery, but
Yeah, okay.
I
Well,
personally in this bucket where I'm starting to think about.
all right. This is where things get wildly fascinating. So you
Yeah.
mentioned knees, so let's just pick a knee replacement. So let's say you're having to have an admission for a knee or a hip replacement. So again, every procedure is different. We ask people actually to get a good faith estimate. All doctors and all providers are required to provide good faith estimates if asked. And when you get that good faith estimate, you take a picture of it just like it was a receipt. We load it. We'll send you an email and say, hey, for that surgery, your benefits are $80,000 in the doctor might be charging 75. So you know that you're saving five and keeping 2,500, or the doctor might be charging more than the benefit amount. You might learn that they're charging 90,000 and your benefits are 80,000. So you know ahead of time that you're going to be responsible for $10,000 if you go to that doctor. But in that particular case, we'll always say, hey, here are three other doctors you may want to consider that are below the benefit amount, and it's your choice. Like everything about our world is about creating consumer knowledge about quality, about cost, and then choice. We're not going to make decisions for you. You and your doctor need to determine the course of care. So in this case, around a knee replacement, let's say the average cash price for a knee replacement admission in Atlanta is 84 grand. Our benefits 84 grand. Here, this is like real data. Like Piedmont Hospital is charging $36,000, right? You're going to save $47,000, right? And you get to keep $23,000.
Yeah.
Like this is why what we're doing works. This is why it's so different than everybody else. South Regional Medical Center, it's $35,000. So we don't have every doctor pricing data in here. We don't have every doctor's quality data in here. We have about half of the doctor's quality data. We have a ton of pricing data, but we encourage people to call and ask. Always get good faith estimates, but be empowered. You're spending $80,000. You should know what's going on. That's how this works.
And presumably you have somebody who's over the top here as well in this list. I don't know. Yeah.
Oh, I'm 100%. I'm sure. Again, for this particular example, I don't know, but like it looks like Northside, which is another great hospital in Atlanta. They're also below the benefit amount. There's Wellstar. I think some of the transparency data suggests that they're going to be more than this,
Yeah.
but I don't have it in
Somebody
hand.
is more as the average cash prices.
100%.
Yeah.
By definition. And let's pick a different example here just to go live. Let's say it's an MRI. I'm just going to pick one randomly. Again, we always have pre-check providers for major things. We'll say the benefit amount is, I must have gone out of Atlanta here. Um, three. It's all it's region specific. Your prices are based on where you live. So okay, there's a bunch of places that are going to be below. I'm sure there's places that are above. We just got to find them. I guess I'm not getting lucky on prices above. They do exist. It's the midpoint.
Okay.
Maybe it's a brain MRI. I'm sure they're here. Well, that's not right. Um, it's patient free. So in any case, there's definitely examples. It's a stomach MRI. Okay, 754. Someone give me something more expensive. Ah, here we
There
go.
you go.
There we go.
With
Right.
that
So
one.
you're definitely going to find places that are more.
Yeah, of course.
Um, of course. Like and I always find that like drug tests and imaging I mean, are not drug tests, like lab blood
Yeah.
tests. Um, it's wild the price variations. Um, so like $26. I'm sure there's gonna be a bunch below, but there's gonna be a bunch above. Obviously, there's a lot. But
Yeah.
hopefully you're getting a sense. Like this is a different, here we go. This
Yeah.
is a different way to think about healthcare, right? It's a way to suddenly start realizing that you can be in control of this. That one of the dialogues here is always that this is also too hard. Like for those of you that have ever dealt with a mortgage, like that's hard. Being able to ask your doctor, like what things cost, what are you going to charge me so I can make a decision is something that we do every day.
So that's fantastic. So let's. I think people get a great idea of what you're doing here with the demo. Now let's talk a bit about a couple of things. First off, uh, uh, what happens? So Sidecar makes money by how keeping that difference driving people up, right? Or
We're a health insurance company, so we're like every other health insurance company. We collect premiums, like you said,
yep,
pay claims, and
yep.
so our margins are controlled by the government. So in the large group space, we have 15%. I guess if you look at the stuff really closely, maybe you can get 17% gross margin, and you with that 17%, you actually have to pay for your claims team, pay for customer service,
Oh.
pay for brokerage fees. We only sell through brokers, so that's how that works. Yeah, so we make money like everybody else.
But what's happening to the extra bit that? So let's say now it was $83,000. I gave 12,000. You know, they did it for 35. I gave 12,000 back to the patient. Where did that 12,000 come? That came from the premiums collected, and you're just
Mhm.
lowering the overall amount of spend.
Yeah. Yeah. What that does is that
So
effectively
in some ways, you're lowering the 85%. So you better
that's exactly right.
you're hurting
So
yourself.
no, but it can't affect the 85% because that's regulated. What ends up happening, and we haven't really talked about this yet, so let's talk about economics. So the way that our product works creates so much engagement. We keep people out of the emergency room. No one's missing a drug, a prescription. They're staying on top of their prescriptions because prescriptions don't cost anything. You always can actually get paid to take your drugs. So you take your drugs. You're not having trouble getting access into doctors because you can go to any doctor. You're not delaying care because you're not waiting for prior auth. So people are 50% less time in the emergency room. You're not overspending on imaging. You're actually spending more on a mental health care, by the way, because we have no barriers for mental health care. It turns out that's one that everybody takes Visa. Almost nobody takes insurance. So, but when you put it all together, we end up with lower claims costs. And so our typical employer saves 20%. I'm going to say that again. Our typical employer saves 20%.
Okay.
That is a massive amount of savings. Now, what's also typical of our employer, which I love, is that so much money. Our typical employer gives, you know, 50, 40% of it back to employees with better coverage. So to be a super dork, because I am one, like the actuarial value of our plans tend to be much higher. Like, for example, out-of-pocket maximum. So on a typical Buca plan, you might have a $2,000 deductible and a $5,000 out-of-pocket. Well, if you have a deductible on our plan, our out-of-pocket maximum is the same as our deductible, right? So out-of-pocket maximum or less. So our plans is an example why one of our reasons our plans are richer. So our economics, back to your question about where does the money go that we're giving back? Well, that means our claims costs were lower, which is another reason why our premiums are lower. Our costs to employers are lower, right?
So
So
that's great. So two other things. One is, how does okay, maybe you'll stop people going to emergency care because they're getting access to primary care or whatever else, but better. How does it work when you hit emergency care and you're seeing these incredible bills that come out of emergency rooms or trauma admissions or what have you? How does that work to you as a company as well as if you're saying, okay, you don't see a bill because we're not pre-planning this for the consumer, but the bill is 197,000, whereas if you'd been able to pre-plan it would have been 52,000 or whatever the number is. How does that impact you?
well, let's first start with the people, because the most important thing is making sure people, our members, the employees are covered, right? Remember, Matthew, I designed this plan for my family,
Hmm?
right? So the most important thing is what the statement that you just made. The members are completely covered, right? And one of my favorite example actually is not the emergency. It's the surprise complication in surgery that no one knew about. Like you were going into a surgeon that you believed you were going to get $500 money back, but there was a $100,000 complication that you didn't know about.
Yeah.
So what happens in that particular case is you are responsible for none of that additional complication. It's treated like an emergency. How would you know? Right? You're not fighting with the insurance company over, well, that was experimental or well, you needed prior authorization for that. Never would happen and you would still get your $500 back. So like it's about protecting the individual. So whether it's an emergency as in an emergency room or it's an emergency as in it was an unplanned event around a planned procedure, you are protected. So that's super important to us and what our values are. Now, your second question is, well, that sounds great. How do you afford the economics? Well, we plan for all of this in our actuarial setting, our actuarial process to set the premiums, right? So we know and can expect how many emergency room visits you're going to get and what you're going to pay. The other thing to know is that we pay really fast. We pay up front, right? Now, emergencies are different because we don't know what happened and the hospital system or emergency room will contact us, but we don't mess around with trying to play hardball with emergency rooms. We pay commercial rates. And so even though we don't have network arrangements with these emergency rooms, the amount of money that we're offering is always the market rate. And so I can tell you with thousands and thousands of emergency room visits, we've not ended up in disputes with emergency room. They're happy to get paid up like without
So
cost.
they'll basically, so let's say they put out the charge master price, but the emergency rate is three times Medicare or whatever. You're paying three times Medicare or whatever.
We're paying whatever the market average price is for commercial patient and access, right? So I can't tell you what that is. Every market's a little different based on the
But you're saying the hospitals in general will take it and they won't come after you aggressively and sue you for the difference.
not in general every time.
Okay. I've heard rumors there are some hospitals which don't play like that way.
Right, but that's a
There was
different
a whole
situation.
surprise
So,
billings thing about that, but you may.
well, so here's the thing that's really important to understand about our business and providers. You can see in the public sphere where providers and payers they
Yeah.
fight a lot. We don't because we go to providers and say, it's very simple working with us. You determine the price you want to charge, and our members decide whether they want to pay it or not. And if they pay it, you get it up front. So there's no question there. The second thing is you're not asking me for permission to do a procedure you know needs to be done. So like we're a doctor's dream. Like if I'm not saying like this is what one of the part of the founding story with Sidecar Health is I need to get that MRI, remember? Well, my insurance at the time would not allow me to get the
Yeah.
MRI before I got a CT scan. So I had to go do a CT scan, got the results. The doctor's like, turns out you need an MRI. That delayed care. In our situation, it's like when the doctor says you need an MRI, you get the MRI. That's powerful. So providers like that. They choose their own price, they have no collection risk, and there's no prior auth, right? And so when we enter into a market, some hospitals might decide to charge more. That's totally fine. And what has happened in that situation, our members decide to go somewhere else. And remember, we're paying commercial rates. So hospital systems right now are overwhelmed with Medicaid pricing, they're overwhelmed with Medicare pricing. Commercial patients is where they make their money. And so if they overcharge our members go somewhere else. They come back to us. We've seen this many times, and they'll say, "Hey, what do I need to do to get your members back?" Well, just pick a rate. We'll tell you what other hospitals are charging, and then you see immediately they're competing for members. So it's a total change in how the market engages with our members than every other
And
health
that
care
reflects
company.
in their emergency rates and their sort of quite surprise rates as well.
Explain that question again.
So, in other words, you know, I've been working on the MRI or on the bundled procedure for hip surgery or whatever,
Sure.
but I have a complication of the hip surgery, or I have an emergency room trauma visit, which wasn't pre-negotiated up front, and that one can I just stick in them? Can I just get away with sticking up the charge master rate that's four times or five times, what the quote unquote commercial prearranged rate would be for a prearranged visit?
Well, again, and I know you know this, but the way the No Surprises Act works for emergency room
Yeah.
visits is like they have to, it has to be the appropriate rate,
Well,
and out
or they go
are
to
the appropriate
arbitration,
rate.
and there's all. But yeah,
Yeah.
I think that's interesting. That plays out. I suspect they can't yet do two different things, but I don't know as that goes on, and there are only a minority of hospitals who've been playing that game, but some of them have been. Anyway,
Yeah, I mean, I understand. Like a lot of times, hospitals, it seems to me, will use that as leverage to try to get negotiated agreements. We don't have negotiated
yeah,
agreements with hospitals. And hospitals literally can set their
they're
price.
setting their own price, right?
Like, so there's nothing to negotiate. If you want to charge 10 times Medicare, have at it. I remember sitting down with one hospital system and explaining our model and saying, hey, we're going to pay the average rate. And it's like, well, we charge more, Patrick, than the average rate. And I said, that's fine. Are you worth it? They're like, what do you mean? I'm like, look, the way our product works is that we make it transparent to our members what other hospitals are charging. And so they can choose you. And by the way, we do see when members actually value and pay more. The only question I have for you, Mr. Hospital, is are you worth it? And they're like, well, we don't know. And I'm like, well, you're going to find out. And that's actually the power of what we're doing. That's how we are able to bend the cost curve for the first time. By empowering consumers with transparency and reasons to care, we create a marketplace where providers are able to charge what they're worth and get paid what they're worth. And consumers, like they do in every other market, they're able to determine what everyone's value is. And that fixes the US healthcare system.
So, second rated question is: now I have a complex chronic condition.
Yeah.
Uh, is there a bundle? I mean, you showed me a bunch of individual procedures, but the issue is for the cost overall is how many of them am I getting? Am I getting the right number? Am I getting the right care plan? And blah blah blah. How are you working on that, and how are you managing that?
Well, again, I mean, we do this all the day. This is not our first rodeo, right? So, we're an 8-year-old health insurance company. So, at the end of the day, we do it two ways. One is through our app, you can look up episodes of care, which is going to be a generic bundle for your particular procedure, your chronic conditions, and that type of management. But that's like I just said, it's generic. What we instead suggest, and this is a crazy idea, we expect your doctor to be determining your course of care. Our job is to pay for it. So, we have what's called benefit navigators, where if you want your care team to call our benefit navigators, we'll make sure that everybody understands what our reimbursements are, how it works, what your benefits are, or you can call us directly and we'll say, hey, if you're trying to manage cancer treatment or other a chronic condition or an extended thing, like, hey, here are like 5 or 6 places in your area that you should consider with that we've seen other members go to that are below the benefit amount, or we can work with a care team of your choice. We want to make sure you know your benefits and that every decision and every journey you're on is completely transparent. A much better example is maternity. Maternity is complicated. It's a journey. It's not one event, right? And so we've got pre-check providers for maternity in every market, and then we can also work with your particular office on that particular journey and make sure you know what extra cost you might have or how much cash back you're going to get.
So in those cases, I mean, if I was to go back into the app, would I see? Are you mostly doing it assuming that the doctor you choose is going to build that journey out for you, or is it actually part of the? Is there a sort of care plan combined cost of care for maternity or cancer or
It's
whatever?
very, it's very, it's very specific on the hospital. So take maternity, they might bundle. They might your hospital might do a bundle. Whereas a cancer journey might be much more tailored. And so that's why we make care navigators available to members and to your doctors of your choosing, so that they can kind of coordinate the payments. The one thing I'll tell you, like let's take cancer for example. I try to spend as much time with our members as possible. Unfortunately, one member I spent time with, his wife was going through cancer management. And what he told me is like, hey, Patrick, this has been incredibly stressful, but the one thing that I know is that I don't have any financial liability. Your team has been amazing, so I can focus on my wife, right? And that's what we're going for. But we want to make sure it's done in a way that you have choices, as opposed to like, no, you have to go here. You must go to this particular doctor. We're not a narrow network plan. We're the broadest, most comprehensive plan available in the United States.
So with that, give me the sort of the next sort of step out of this. So you've got these bundled episodes of people who have chronic illness. You obviously have lots of sort of things that might or may not go into bundle episodes, which is I need
Sure.
an MRI for that, maybe a one off,
Sure.
and maybe it's same with drugs and all the rest of it. Um, in the end, are you? I see you're putting everyone everywhere, but are you in the end directing a similar amount of traffic to certain providers over
No,
others?
wait. So here's what's super interesting. At the end of the day, we're creating a marketplace in healthcare, right? It's a result of our action of taking care of patients and making people consumers of healthcare for the first time. We're not directing people anywhere. Again, our margins are controlled by the government, and we just want people to have choice, access, knowledge in their decisions, right? So we want to enable providers that want to compete for members to be able to do so, right? So we want to make that available to them. And like whether you're a point solution like Hinge Health and you can actually try to highlight people that are looking for MSK solutions, or if you're a provider in a particular area that's trying to promote their cardiac practice, we want to make sure people know you're there. But we're never going to tell someone, hey, you should go here. What we're going to do is if you send us a good faith estimate that's above your benefit amount, we're going to tell you here are some other options you might want to consider, and here's what their quality and costs are.
So, but you have people like Hinge Health or other virtual providers on the system.
We have anybody that want that, like usually, like let's take a large jumbo client. They'll determine the point solutions that they want to make available to their members, and point solutions can come to us and they can show up in our list, like
No, I see.
right. So it's like again, we're literally Switzerland. Yeah.
It's sort of I'm comparing and contrasting a little bit with the sort of the more typical navigator types like included
Yeah, we're not an app. We're
or
not going to tell you where to go.
you've got some navigation aspects to give help to clients, but you're not actually saying we're going to pick these three things and we're going to have a
No, that's exactly right.
plan.
We truly want your doctor determining the course of care, because it turns out your doctor knows what you need, not us.
No, and I think,
It's
frankly,
a crazy concept.
well, I think, yeah, there is obviously as you're well aware, there's a ton of price variation, there's a ton of quality variation, there's a ton of practice variation. Um,
Yep.
and that's been the sort of bane of the US healthcare system. It's all been done behind the veils. And then the other thing, of course, is that the price obfuscation, not just variation, has got lots of stuff going on behind it. And
Yeah.
we're hearing all this about PBMs and drugs. Not to mention the same stuff is going on in terms of kickbacks and God knows what else in terms of and variation in terms of pricing for inpatient and outpatient procedures. And there's lots of ways hospitals are making money off the government, et cetera, et cetera, et cetera.
Yeah, but transparency solves a lot of this problem. Like it is like we've talked
When
about.
it's not ignored, right? But the point about your system is that it's actually impacting, right? Typically, transparency it's hard to figure out. They post
Right.
up stuff, it matters.
Right.
The health
You
plans haven't, in general, paid a lot of attention to actually try to
well,
get the lower price
well,
for
again,
the
like
network.
these are the same health plans that Kaiser Family Foundation says they are have a 19% in-network denial rate. And it's not okay, right? If and I think United came out and published that their denial rate is, if you look at it this way, is 10%. And like I guess where I really struggle is like, why are we okay with this at all? Forget 19%. Why are we saying 10% is okay? Like it's not okay for my family. As you know, as you've gotten to know us, like our denial rate last year was well below 1%, right? Because again, we want to make sure people are getting care. Like it seems to me like the US healthcare system is designed to make it hard to access care, delaying care, right? And that leads to worse outcomes, higher costs. And the whole purpose is just trying to constrain costs because it's so expensive. Why don't we do what every other market does and actually create an opportunity for people to decide what they value, be informed in the decisions that they make, and actually make those decisions? And you can see people like that actually drives costs down. Our plans are on average 20% cheaper than comparable plans from that have the same richness value as our plans than all the major brands, right?
So let's talk a second about where you are as a company and how this can extend. Because yes, commercial is very important. Commercial is super important for the
Yeah.
provider community because, as you mentioned, it's the most profitable part. Um, you can, at a sense, if you don't have that many members, you kind of that yes, they'd rather get the deal than not get the deal. If this became mainstream, number one, how does it go to Medicare? Can you start running this as a Medicare Advantage plan?
Yeah.
Can it somehow, be a front? I mean, right now there's an RFI out from HHS looking for new solutions. Could this be something that standard Medicare could use?
Mhm.
Even Medicaid. In other words, how do you even further mainstream this as an approach? Now the technology's there, and now you've basically built the system. So that's sort of the first question. And then the second question is, if you did that to enough, if you got it mainstream enough, would it be 20% across the board or would it be 2%? Because reversion to the mean, you find that people would say, well, there are so many of these people coming through Sidecar or the equivalent. I can't give them that rate. I'm now giving, I can't give them the teaser cash rate. They've got to come back to my more average cost rate. What do you think?
Okay, so let's answer both those questions because they're super important.
Yeah.
The first is we fundamentally believe this is the only path forward for US healthcare. I'm going to just pause on that comment.
You don't
This is
you don't you
not
don't hold with my nationalize everyone and give them a fixed budget idea.
Look, if I was in charge, and there's lots of reasons I'm not, why wouldn't healthcare be nationalized? I understand the thought on it. Everybody should have access to quality healthcare right now, but like at the end of the day, that's not going to happen in the US. Like there's lots of reasons not
I,
to.
I I understand it is certainly not not
But
normal.
look, the point here is that
A
our
struggle.
approach in empowering consumers, right, giving them choice, making sure providers actually have to be transparent about their quality and their costs, right? That actually bends the cost curve, drives down healthcare, right? So it is not a question about whether or not this is the way that the whole market will go. It will. The advantage is too big. The one of the question is like, how do we make sure as a company that we are the leader and we're not, the pioneer, and that someone else actually ends up being the leader, right? So we want to make sure that
Didn't United have a thing? I forget what it was called that then got integrated. It's now actually a fast growing brand of theirs where you buy. Oh, I've forgotten the name of their product, but they have a product that's not a million miles away from this. It's where consumers can buy slices of care. Run by the guy who was at Carol.
I'm not sure. They have a
I will
protocol.
have to. You answer the second question. I'll Google that one.
Okay, but let me keep answering the first question answer. So, like, our view is that Medicare Advantage, absolutely. Medicaid, we've actually had states ask us if we would ultimately want to take over their Medicaid program. In fact, the former director of healthcare for California and ran Medi-Cal, Jennifer Kent, sits on our board, right? So, the vision for our business, we're a mission-driven company that believes that everybody deserves access to quality, affordable healthcare. And by our approach of empowering consumers, we can lower the cost of care in every market. Today, we're focused only on employer. It's $1 trillion market, and we are venture backed, so we need to be focused about that, and we don't want to get diluted. But ultimately, we will offer Medicare Advantage plans, Medicaid plans. As you know, we had an ACA plan. So, like at the end of the day, we believe we can actually, despite Warren Buffett's statement that the healthcare system is a tapeworm, we believe, and we can see it in hard data, that we can use market economics to actually solve that problem. And we're, by the way, happy to work with other carriers that want to use the same approach. Maybe we can license them into some data so that they can do this. Maybe we can license them some technology. We want to bring the whole market here, and we will do that over time. So that's the answer to the first question. We have no small vision of what we can accomplish. Your second question, can you phrase it again?
Yeah, it's kind of like does the prices
Oh, do the prices move back? I love this
move?
question. I love this question because that's what happens in every other market, right? You introduce competition and prices go up.
Well, it's
No,
not going to go up, but I mean, then it revert
it
back to.
doesn't happen. So let's go back to the MRI example. So the MRI example is why is a major hospital system charging $5,000 for an MRI when the same machine is available on a standalone MRI like center for $300? Like there's no difference in quality of care. There's no difference in care at all. Right. So the problem is today in the existing system, there is no transparency. There is no need to make that trade-off, and costs are getting smooth, and there isn't accountability in the healthcare system. And so what ends up happening when you introduce our type of model, let me give you another example. It actually brings balance to it. There is a hospitalist system that I can give you an example with. I don't want to share with them their name online, but like I was sitting there with their COO and sharing an example of three surgeries done at their hospital system. Two of them, so with the same doctor at different locations. One was $9,000, one was $17,000, same procedure, same doctor, different building, almost double the price. That same hospital system had a surgery center that would do that procedure for $3,800. So again, this is the same hospital system, the same quality scores. There is the $3,800 to $17,000 difference. That's the COO I was talking to about that was actually surprised that it was like there is just not knowledge that this is happening. And so for the statement of like, oh, this is just because 2% of the market is doing this. If it was 50% of the market would change, like the fact that is just one example of one surgery at one hospital, their chosen pricing. Like we need to bring market forces to this to make it work. So no, prices will become rational, which will bring them down.
Okay. And by the way, I figured out who the United version is. This is Surest, which used to be called.
Surest, yeah. So
Okay.
Surest is a great concept, right? They're trying to create incentives, from my understanding of it. I don't pretend to be an expert, but they're trying to create incentives within the United network. Like, hey, we're going to charge you a $2,000 copay to go to that doctor because we'd like to actually go here where it's going to be a $100 copay. That's great. I love that you're trying to create some incentives within the market. That is on the journey towards where we are, which is a market-based solution. So that's great. It would be awesome
Yeah, and I
if
mean,
more people at least do that.
and again, it's grown recently. It's been my understanding it's grown relatively fast. It's being a cheaper. It's being a cheaper product, and the problem, and there are other people doing variants. Like we talked about the navigators who are trying to do that. There's the people who are doing the sort of the networks of excellence approach. And I just interviewed one. I'm blanking on the name of the guy and the company. Uh, I will come back to that one as well. This is the early onset Alzheimer's brain, which is you're seeing. I'm not sure you ever.
We have coverage for that.
The issue is there's lots of ways of coming at that, and I think the question is, how do you get the market to figure out the employer market to move, because they have been very slow to move to things that are cheaper. Better. So let's end with the question of going back to Sidecar. You've only been doing this a few years. Give me a concept of numbers of people coming onto the system, number of employers, the amount of growth. You're in a bunch of states now. How big have you been, and how big are you getting, So to the point where you want to
Yeah,
be.
I mean, so we're
Yeah.
we're 8 years old. We've been in this particular market for what, 3 years? We're in our
Yeah.
fourth. We've been more than doubling every year. There's no sign that's ever going to stop. Like we actually had to change our quoting process because our demand for quotes is too large, so that now we won't quote people that come to us. Like you have to have a relationship with us. You have to take a meeting with us. So like we could not be happier. We don't need to be growing any faster. We're also going to be deliberate. I think some of the things that venture-backed insurance company in particulars have done is they've grown without really focusing on profitability. Like MLRs are critically important. Like most de novo health insurance companies lose money on MLRs. They're basically buying business. We don't, right? Like so at the end of the day, like our MLRs have been right on target where they need to be 3 years running. So like at the end of the day, like we're trying to do sustainable, profitable growth in markets that we can serve, and we like the really fast pace that we're moving at.
And how much you guys raised? There was a big round a while back.
Yeah. So we've raised $360 million, which is like 15%
It's
of what
not
our,
quite Oscar money or Clover money yet.
it's like a tenth of that. Yeah. Because again, we don't need to. If you look at their financials, the reason why they had to raise that much money is they're losing money on the medical expenses. When you're not losing money on medical expenses, you don't need to raise that type of money.
But and when was your last round?
Our last round was a year ago.
Okay, great to hear. Fantastic. So, and then give me a sense of how many people are on the system now, and if you're doubling every year, the number's changing. But what's the membership roughly at the moment?
Yeah, and big enough to be statistic and material, big enough to cover employees in 47 states. If you're looking for a specific number, you're going to have to get a pitch book.
All right. I'll see. I'll see if I go into that. All right, brilliant. Okay, I've been joined by Patrick Quigley. He is the CEO of Sidecar Health. He's given us a long demo, long discussion about how we're going to do this. One of the many and very interesting approaches how we're going to fix that whole pricing transparency care coverage mess that is the US healthcare system. Very interesting, innovative approach. Patrick, thank you for your time. Really fun talking with you. Thanks for the demo, and good luck as you keep going forward.
Really appreciate it, Matthew. Always enjoy the conversation.